Well, we're a few minutes ahead of schedule. And as we move along, our next guest speaker is Delia Jervier. She is the Regional Leader and Executive Director at the Alzheimer's Association. She's the leader of the Region 9 for Illinois, Greater Kentucky, and the Greater Indiana area. Delia, the Zoom room is all yours.
All right. Well, thank you, Susan. As Susan mentioned, my name is Delia Jervier, and I'm the Executive Director for the Illinois chapter of the Alzheimer's Association, and also Region 9 lead, which is encompassing of chapters Illinois, Greater Kentucky, and Greater Indiana. First of all, I'd like to thank you for inviting me to be part of the program this morning. It kicked off to a great start with Lieutenant Governor Stratton, who is a staunch supporter of the Alzheimer's Association and the work that we do. So it was great to be preceded by her. I have a video that I would like to share this morning, and I'm hoping that we can get it started now. Okay, well, the world of technology, you never know what's going to happen. So we're going to go ahead and, okay. The Alzheimer's Association leads the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. One of the ways that we provide care and support to families who are affected by this disease is through our helpline. The number is 1-800-272-3900. That's 1-800-272-3900. It's available 24/7, all day, all night, including holidays. Individuals can contact the number and receive information from master's level licensed professionals in over 150 languages. Throughout the years, we've heard stories from caregivers who have called when they received a diagnosis because they had nowhere else to turn. Or we've heard from caregivers who, for instance, come home and a spouse is not recognized and their loved one is about to call the police. So we have had a spouse call the 1-800 number to find out what they could do to avoid having a situation become more critical than it needed to be. And so The licensed professional on the other end spoke to the gentleman at the time and gave him the simple instruction of going back outside, coming back in, and saying something like, "Honey, I'm home." And in this particular instance, the situation was diffused and everything went back to as normal as could be. Other stories include children who are caring for their loved ones, an 18-year-old who was caring for their father who was older and had the disease. And she was having a really rough time at 2 o'clock in the morning. No one to talk to, was just really needing to vent. Called our 1-800 number, and there was a listening ear on the other end that was simply there to listen to her vent about the day that she had in caring for her dad. Those are the types of stories that we hear every single day from individuals who receive the support that they need after calling the helpline. Again, that number is 1-800-272-3900. We also provide programs and services through educational presentation. Now, this past March, we as an association took on the work of pivoting all of our in-person programs to a virtual format as a result of COVID-19. It was something that was very hard to do, but in order to keep everyone safe and healthy, we had to make that tough decision. So today, all of our programs and services are offered through the phone or online. Programs like our Know the 10 Signs presentation, or the Healthy Living for Your Brain and Body, or Dementia Conversations, or Effective Communication Strategies. Those are all programs that can be available to you at no cost. We provide the speaker, we make the arrangements, and again, this is being done virtually today as a result of COVID-19, but very effectively. Pivoting to a virtual format has not slowed down our ability to support caregivers in our community. As a matter of fact, in some cases, we've seen increased participation on some of those educational programs, because what we found is that a caregiver sometimes after work may not have had the time to drive to another location to receive education. So right now they're able to simply turn on the computer or join by phone. Those presentations are available both in English and Spanish. We also provide our support group services online and by phone. So there are a number of support groups available throughout the state for caregivers, as well as a very active early stage support group program. Again, you can learn all about those programs by calling our 1-800 number, 800-272-3900, or visiting our website at alz.org/Illinois. That's alz.org/Illinois. Now, in Illinois, there are over 230,000 seniors over the age of 65 who have Alzheimer's disease. And we estimate that that number could grow by 13% by 2050. Close to 600,000 caregivers are caring for those seniors. As an association, in addition to care and support, we advocate for people with Alzheimer's disease and their family. We develop policy resources, including the Alzheimer's disease facts and figures, to educate decision makers on the economic and emotional toll that Alzheimer's takes on families and the nation. The video that you saw earlier is an example of the types of resources that we make available to those policymakers as well as the public. In recent years, we've achieved significant successes in increasing funding for research at the NIH. As early as 2011, we were only funded, the Alzheimer's disease research was only funded but to the tune of about $400 million. But since 2011, Through the advocacy efforts of the Alzheimer's Association, we've increased that number to $2.8 billion, and that's billion with a B. 400 million to 2.8 billion. And we are currently advocating for an additional $354 million for the 2021 budget season. And currently, the Senate Labor, Health and Human Services Subcommittee has approved the additional funding. We're optimistic that this will be included in our 2021 budget. If it happens, that will take our funding to over $3 billion. Over $3 billion from 400 million just 8 years or so ago, 9 years ago. That is incredible. As you heard earlier from Lieutenant Governor Stratton, we are working diligently in establishing the state of Illinois as a dementia-capable state. Until a cure or prevention is found, we are focused on creating and on making this happen. This means that we must provide comprehensive supports and services for people living with dementia, as well as their caregivers. These include, but are not limited to, increasing public awareness and early detection diagnosis campaign. In our facts and figures a couple of years ago, we found that 80% of seniors knew that a cognitive assessment should be included in their annual wellness check. And more than 90% of physicians also know that this should be included. However, only 13% of seniors are actually receiving a cognitive assessment. Cognitive assessment being one of the tools utilized for early detection. And so that is why it's so critical that we increase public awareness about asking for this tool, for this assessment to be done during the senior's wellness check. It's critical that they ask for it. Because again, the patient knows that they're supposed to receive it, but because they don't ask, it's not given. So public awareness is a key. We also want to prevent financial exploitation, abuse, and neglect. Creating a dementia-capable workforce is critical to a dementia-capable state. Increasing access to home and community-based services, and advancing the quality of care in residential settings. Illinois is working to become dementia-capable through the Alzheimer's State Plan, drafted and updated every 3 years by the Alzheimer's Disease Advisory Committee, ADAC. Both the plan and creation of ADAC were efforts successfully drafted and lobbied by the association's public policy department. I want to highlight a couple of successes from the Illinois in the last few years. We have increased the state funding to support research to $10 million annually at the 3 Alzheimer's disease research centers in Illinois: Rush, Northwestern, and SIU. We have created a full-time dementia coordinator position at the Illinois Department of Public Health, which will help Illinois become dementia capable through the implementation of the Illinois Alzheimer's State Plan. We authorized and launched a scratch-off lottery ticket to provide vital funding for Alzheimer's care support, educational awareness of the Illinois chapter. This was launched in September of this year. We've expanded the home and community-based services provided to those in need through the state of Illinois Community Care Program, which allows people living with a dementia to stay in the home longer rather than premature institutionalization. New mandated dementia training for direct care workers in both long-term care settings and home services have been implemented. I also want to point out, in terms of circling back to research, that Chicago is the site of, is one of 5 sites where we have this US Pointer study. And the US Pointer study is completely funded, excuse me, Sorry about that. The US Pointer study is completely funded by the Alzheimer's Association, and it's a study that hopefully will be able to establish that through lifestyle changes, it's completely designed for lifestyle changes, not medication related, but we're hoping that at the end of the US Pointer study, we can establish that through proper diet and exercise, that we can convincingly say that developing Alzheimer's disease can be prevented. So the US Pointer study is done in Chicago. We're one of 5 sites in the country. In 2020, the Alzheimer's Association partnered with Lieutenant Governor Stratton to introduce legislation that would require all physicians who see patients receive training regarding dementia as part of both their initial certification and as part of their continuing education requirements. We will be working to pass this legislation in the 2021 legislative session. The Alzheimer's Association is also working to require dementia training for adult protective services caseworkers. These individuals are on the front lines of protecting older adults, many of whom have Alzheimer's or other dementia from abuse and exploitation. Protecting and strengthening home and community-based services will also be a major policy priority for the association in 2021 as we realign services and access. The association will be working with the Lieutenant Governor to identify vital funds to create a statewide awareness campaign with particular emphasis towards reaching those in diverse and underserved communities. The association will be seeking the renewal of the Alzheimer's scratch-off lottery ticket to preserve this vital funding stream that support care, education, and awareness. So until there's a cure, there's the Alzheimer's Association. We are in 8 offices across the state of Illinois. And again, we can be reached at 1-800-272-3900 for care and support, questions, referrals. If someone is looking for a particular service or they're looking to relocate their loved one and they are trying to find services available, they can contact our 1-800 number and a live person will answer the phone to direct you to where you need help in English and Spanish as well, and other languages. So Susan, this is all I had to share this morning, and I welcome questions.
Thank you, Delia. We do have quite a few questions in here. Let me get to the beginning. Can you address the stigma of getting genetic testing and the confidentiality around the testing, and does that affect an individual's health insurance?
To date, we have not been given any indication that that affects or is shared information that's shared with any insurance company. It is something that is absolutely kept private, and the association has not been given any indication that confidentiality or your ability to get insurance and coverage is at risk as a result of genetic testing.
Another question, with regard to participating in clinical trials, how are those being conducted now with the resurgence of COVID and people aren't going into offices for for participation?
So, and that is a great question. We have had to pivot a lot of the work that's done with clinical trials right now through telemedicine. So a lot of the work is done that way for now. And certainly trial or clinical trials have been slowed down as a result of COVID. There is resurgence of those types of activities that we just recently, really not as much as it used to be, because a lot of it is being done virtually through telemedicine. And we have to be extremely careful about having people come into offices right now. So a lot of the work has kind of slowed down and be put on hold as a result of COVID. But I do know that it's picked up just slightly through whatever can be done through telemedicine is currently being done until further notice.
Someone asked if we could clarify between going to a genetic specialist versus the 23andMe.
So I am not a health professional, and so I can't really speak to the differences between those two types of testings, but I would encourage you to call our 1-800 number where there will be somebody that can answer that particular question. It's just not my area of expertise, and I don't want to mislead you.
Maybe we'll save that one for when our physicians come on later today.
Yeah.
Many of us work in communities that are striving to become dementia friendly. How does this complement and support the dementia capable state initiative?
I think they very much complement each other. I would imagine that some of the requirements that are in both services and in both program probably complement each other. And so I don't want to be misleading. Dementia friendly communities are what we are working with health systems to establish as well. We're trying to make sure that health systems are dementia friendly. And I think the work between those two are complementary of each other, really.
Another question, what age range is considered for senior and the physicals? And what about early onset of Alzheimer's?
So 65 years of age is the age for cognitive assessment. Early onset is, individuals that are below the ages of 65. If you have Alzheimer's disease, that's the early onset diagnosis. And certainly at 65 years of age is when we establish cognitive assessments being a required part of the wellness annual check. But that is something that can be made available if there are signs and symptoms already happening, such as memory loss. If a physician establishes that there are signs and symptoms earlier than the age of 65, then it can be requested by the patient.
Thank you. How influential are the pharma companies who want to remain in business with their medications that slow down the disease? And how much power do they have with a cure? All these funds being raised and more people are being afflicted. That's a loaded question.
Well, I would say that the Alzheimer's Association has always prided itself in remaining very neutral when it comes to their involvement with pharma. We are supportive of the most recent development around Biogen and the possibility of a drug that is potentially could be approved by the FDA, which will be the first time that we have a new drug in over 15 years that could help slow down the symptoms of Alzheimer's disease. But aside from that, the association has really prided itself in remaining neutral and not necessarily not necessarily picked one over another when it comes to pharma. So, but because we're really wanting to make sure that whatever drug comes out is something that is going to be beneficial to the patient. And we know that families are suffering with this disease. And so any sign of relief is something that the association supports, but not, again, we typically have been very neutral when it comes to working with pharma. So they don't have power over us.
I'm pleased to see that Dr. Gilliman is in the audience. He's coming up later, but he wanted to respond that genetic specialists can provide much more information about the meaning of testing. Thank you very much.
Thank you.
He also added that Advocate has the safeguard promise in which they do everything to protect their patients and research subjects from the risk of COVID, universal masking, enhanced cleaning, screening of employees, and et cetera. They focus on the science, and if a medication is safe and effective, then approval is supported, and Rush has a very similar program. Any other questions? See anything? Let me just check everything.
So happy to hear Dr. Gilman is going to be part of your program today. We work closely with him as well.
Let's see, there's another question here. I'm just waiting. Anna? Anna, did you have a question? No? Okay. All right. I think we've covered everything, Delia.
Well, thank you for having me. There were some hard ones in there, but hopefully I was able to cover and help your audience. So thank you for having me today.
Well, thank you for joining us this morning. Your insight and knowledge is very appreciated, and we certainly support and recognize all the work that the Alzheimer's Association is doing. And get involved, be an advocate for yourself or a family member. We're all aging ourselves. Thank you so much.